Dr. Patel, there's lots of talk about, obviously the amalgam filling and the old-time silver filling. So the question is, if people have silver fillings in their mouth, should they take it out? Should they leave it in? That's really kind of like a hot question out there, which, what do you think about it?
Well, yes, it's a hot question. It's a question which is being debated even in ADA meetings and everywhere, and ADA has not 100% recommended us to take out all the silver filling from the patient's mouth. But there is the big thing nowadays in our social life called internet. The internet is flying with all these things which the patients are getting educated. Once they get educated, they see the disadvantages of silver filling and they come and ask us, is silver filling good enough to treat my disease? Should I remove it from my mouth? We always recommend that removal of silver filling is not necessary to treat your disease. But I would recommend you to use a white filling because our office does not use silver filling. When there is so much controversy going about a material being used in the patient's mouth, why should I be using it and jeopardize my patient's life? Though it is not proved, but we do believe in that we should not be using it. So our office since the last 10 years has been using only white fillings. White fillings nowadays are much more stronger, as strong as the silver filling. So why not use the silver filling? White filling binds very, very well with the side of the cavity and forms a chemical bondage where nothing sips in. Whereas the silver filling itself, it shrinks after a while. When the silver shrinks, it creates crevices between the tooth and the silver. And the secondary decay happens more from the silver filling. For those reasons, we may remove the silver filling. A silver filling, when we see under the intraoral camera, we see internal cracks in the silver filling. We see big cracks, crevices in the silver filling. That is why we recommend to change the silver filling. Otherwise, just for disease sake, when somebody comes, I've got MS or I've got this disease and I want to remove this, I want to holistically remove it, we don't habitually remove those type of fillings. We educate our patients, I would remove it for this reason. Because I can see cracks. I would remove it because there is a gap between silver filling and the tooth structure itself. I would remove it for those reasons, but I would not remove it to make sure. But some of the cases where the patient is so strongly saying that I want to remove it, and if you do not remove it, I will go to another dentist to remove it. In those kind of cases, we do remove it.
Well, all right.
Just because the psychology of the patient is affected here. You have to see the psychology of the patient. Because he will be affected all his life.
Right.
If I don't remove it, the next door dentist would remove it anyway. But we try and educate them not to remove it first.
Got it. I can see you're not wishy-washy about this question. You know what it is.
Yes, thank you.
Dr. Patel. I'm sure that the people...
Thank you, Alvin. Thank you.
People listening to this video will now have a very clear opinion. There was nothing uncertain about your answers. Thank you.